Are there any ways of boosting HGH without actually taking it?
And the short answer is yes. Okay, so this is something that's really becoming big, biohacking as well as in the health span longevity space. And so there's actually a couple of approved therapeutics that are out there, testosterone and sermorelin, which are synthetic forms of growth hormone releasing hormone or growth hormone releasing peptides. So kind of taking a step back, biology-wise, human growth hormone, or HGH, comes from your pituitary gland. Now, in order to stimulate the production of HGH, it comes from this growth hormone releasing hormone or growth hormone releasing peptide, depending upon who you speak to, that comes from the hypothalamus, and that stimulates your pituitary. Because literally, they're like right next to each other. And so some of the things, so if you are able to increase this growth hormone releasing hormone, you will produce more HGH. Now, there's a lot of factors that go into play regarding the production of this growth hormone releasing hormone. We've talked about this before on the show. One of them is ghrelin. So ghrelin is the hormone that is actually responsible for appetite. It's the one that makes you feel hungry. And so when somebody's taking something like Ozempic or Wegovy, tirzepatide, the GLP-1 receptor agonists that are out there, those actually artificially suppress the amount of ghrelin that your stomach and your stomach actually produces, which actually has a negative effect on the amount of growth hormone releasing hormone actually produced, and will actually reduce the amount of HGH you actually produce. So now, unfortunately, because we're also all aging, over time, your pituitary stops producing. It becomes less responsive to the natural amounts of growth hormone releasing hormone that is produced. And so your pituitary becomes less active and ends up over time producing less HGH. So, one of the things that people are very interested in from the benefits of is supplementing growth hormone, which we've already talked about in this show. So a lot of times this is used by athletes, because it results in, bigger muscles and in other benefits. But you can get also some of the same net effect without actually putting HGH into the system. And one of the risks that comes with HGH is you can actually overdose on HGH and take too much.
Oh my God.
Because again, just like with every system in the human body, if it's not in isolation, okay, there's always feedback mechanisms. And so if you increase one thing, you're decreasing or increasing something else in response to that. This is one of the pitfalls when it comes to science, especially in my industry, in the biopharmaceutical world. A lot of things are studied in isolation. And yes, when you go and you look at that pathway in isolation, you can get some very, very nice things. You take one step away, oh shit. But whether or not that coincides with your scientific or business goals, you might not ever go and look at something like that. So this is where testosterone and sermorelin, I'm blanking on the brand name of testosterone. Sermorelin is, Giraffe is one of the brand names for it. But long story short, these are synthetic short versions of growth hormone releasing hormone. So like the sermorelin is the 1 through 29 peptide, and we're putting a picture of the structure on that. And then the the testosterone is a different portion of growth hormone releasing peptide. Long story short, you inject those into your body, and then it basically supplements the amount of hormone that's released from the hypothalamus to stimulate the pituitary, just simply because over time, when you're aging, it just becomes less responsive. So you put more of the stimulant into there, your body's going to start producing more growth hormone. That's why there's this huge interest from a health span as well as lifespan longevity standpoint, is because over time that stuff just naturally starts to taper off. So again, these are therapeutically approved drugs from the FDA. You can turn around and you can speak with a provider to get a script for this. These are actually available legitimately through compounding pharmacies. So you as a consumer can turn around and buy them, as well as the actual name brands from major pharmaceutical manufacturers. And there are clear-cut protocols that you can use in order to use these drugs safely and effectively. So again, we're not talking about anything from like a biohacking standpoint, like a back alley steroid dealing. We're not talking about anything like that. We're talking about legitimate science that has been studied, that prescribers are willing to go and put their license on the line for this. Now, if you are going to go on to this, there are certain things that you need to be very aware of, and your prescriber should be doing certain tests when it comes to this. So two of the tests that I know are very common with this is they go and they look at your insulin, your IGF-1, your insulin-like growth factor 1. We've also done an episode on this, that IGF-1 is actually the workhorse of your HGH. You know, your HGH goes, one of the things it does is it goes to your liver, tells your liver produce IGF-1, and then that stimulates, the IGF-1 turns around and tells things like your muscles grow bigger. And this is why it's the IGF-1 is the number one abused drug in professional sports as far as I know. So one of the things they look for is IGF-1 to determine, okay, yes, you are producing actual HGH. The second thing that you should be also looking for is like prolactin, because that's another prolactin is actually produced by the pituitary, and they just want to be able to see, are we actually stimulating the pituitary? So stimulating the pituitary appropriately. So if we're giving you an amount of either the testosterone and the sermorelin, is it stimulating your pituitary, which by default is prolactin and or IGF-1. And the second thing is the amount of increase of prolactin or IGF-1 reasonable within the amount of sermorelin or testosterone that's actually be given as a dose. And so if it's within we would expect your prolactin from this amount of dose to go up by this amount. If you go and you give this dose and your prolactin skyrockets, that's an indicator that you've got some sort of issue with your pituitary and you need to go off of the drug. So this is something where work with the prescriber, get blood work done, because if you go rogue and you are somebody who has like an undiagnosed pituitary tumor, you're going to wind up having problems because of this. So, there's, again, everything has its place. Do it responsibly. This is something, again, I know people like Dr. Michael Olson, who's been on this show. I know he prescribes these as a part of his Valley Health Span, as a part of his treatment with it. Again, work very, very well. Has to be done responsibly. So again, it results in the production of human growth hormone. Unlike human growth hormone, you can't overdose on these, which is actually, which is a huge benefit, because it modulates a lot better. And not to sit there and say that there isn't any. It's not like there's a free lunch that comes with this, because if you have a pituitary tumor, and those are actually more common than one would actually think. So if anybody out there has ever had a parathyroid adenoma, or you've been diagnosed with benign tumors in your pancreas, you need to be very, very careful, because you actually might have something called multiple endocrine neoplasia type 2. And if you have that, then if you have one, more than likely you could have a pituitary tumor, and this could kind of put that into overdrive and stuff. So that's just something that you need to be aware of. But I appreciate the question, on this, and there are suitable alternatives. Talk with your clinical provider and see if that is right for you.